The missions of NewsNation, one of my personal missions and one of Morning America's missions is to not just talk at you, but we're going to have a conversation with America every single morning, answering your questions. According to the latest results from the Pennsylvania primary poll, when Americans were asked, what do you think is the most important issue facing the country? The economy was number one at just under 40%. Healthcare was selected as the number two answer at just under 17%. And in response to this data, we wanted to know what everyday people thought. And one of our NewsNation viewers in Ohio, Randy Natoli, is joining us right now. Randy, you reached out to us through our website. You had some concerns about health care, and White House columnist for The Hill, Niall Stanage, joining us to give us some answers according to the latest policy. First of all, good morning to you. Randy, thank you for being with us. Your mom...
Thanks for having me.
Absolutely. Your mom happens to be 89 years old. She's been in and out of the hospital for months, which can be stressful enough for a family. But are there other family members that need additional medical care in your family?
Yes, we were dealing with the same thing with my father recently, and my wife as well. She has rheumatoid arthritis, and it's been a battle for her for over 20 years now.
And it's such a reality. This is the reality that so many Americans are dealing with, not just to medicate situations, but to recover and the lengthy time it takes to recover from some of these illnesses. The cost of insurance has always been an important topic for so many Americans. What's your first question for Niall, Randy?
Well, one of the thoughts I have many of them, but we'll just stay with one here. You know, it doesn't take a whole lot of research and going onto Google and looking to see what has happened with prices of prescriptions and healthcare and so forth. But it just seems like we are willing to look the other way for some reason. For pharmaceuticals is one of them. We've seen an escalation of the prices starting in the 90s. It really went up. What do you think is the cause behind this with the escalation of prices?
Hey, Randy. So thanks for joining us. There are a number of factors to that. One is simply the expansion of healthcare and health treatments itself. But the issue of drug prices is a somewhat complicated one. The drug companies argue that they need patents in order to make the process of developing drugs profitable. They point out that new drugs take about 10 years to develop and cost about $1 billion. So patents are certainly driving that up. President Biden has put forth an idea that there's some bipartisan agreement which is allowing Medicare to negotiate drug prices. But you're right, I mean, there's a whole bigger issue about the health sector generally and the way that has expanded to the point where it's now about 1/6 of the whole American economy.
Randy, does that help clarify things for you at all?
It does, but it doesn't, because it still seems like it's being controlled by less and less people is the way it feels. Same thing with
like a monopoly
with the insurance industry. So much of it's controlled by the insurance industry itself, and it seemed to be leaning more and more towards almost like a monopoly.
Niall, do you have any thoughts on something?
Sure. I mean, absolutely. One of the big example of a policy that would greatly diminish the role of the insurance industry would be something like Medicare for all. That is, by some, considered a left-wing idea, but essentially the most ambitious elements of that would do away with the private insurance industry and have government fund the cost of healthcare. Now, there is a trade-off, right? If that happens, it means that you're not paying insurance premiums at all, but healthcare isn't free. So the cost then is being funded by tax increases. That has proven a difficult sell politically in the United States, to say to people, yes, your taxes are going to go up, but your insurance premiums will be eliminated.
We have time for one more quick question. Randy, you say particularly over the last few months, it has been very difficult dealing with hospitals. Can you ask about that?
Well, hospitals in the administrative side, the people themselves, I think, have been wonderful, but the administrative side of the billing side of it is just an absolute nightmare. Dealing with this with the government, my father, who just 2 months ago passed away as well, dealing with him with the government. He was a veteran, so we're trying to deal with that aspect of it. It's just everywhere you go, it's just you're passed on to somebody else who seems to be the one that's going to solve the problem for you, and you get there and you find out, no, now you have to call somebody else again. And it's just, I can spend 5-6 hours a day on the phone.
Wow.
Just administratively trying to resolve things.
Niall, what's going on?
One of the elements of this is that there are so many different moving parts in the American healthcare system. Randy, I really sympathize with your situation. As it happens, my own father was hospitalized earlier this week. He obviously is the other side of the Atlantic, which is the British National Health Service. And I mention that because in that situation, of course, we have all the stresses, but we don't have that amount of activity that you're talking about, where you're going from pillar to post, trying to sort out someone's healthcare. It is a function of the very disjointed nature of the American healthcare system, and there honestly isn't an easy fix. I wish I could tell you there was.
Yeah, and it seems as though what needs to happen is a total revamp of the healthcare system, where compassion returns. Our nurses are clearly stressed out, and our doctors as well. I mean, this has been 2 years of an overtaxed healthcare system, which is only revealing how many problems and how deep they are with ongoing problems. Randy, thank you. Again, there are no easy answers, but we hope that this conversation at least encourages you that some people in this country are thinking about it, and perhaps the medical community is taking notice.
Okay, I appreciate that. Thank you for the opportunity.
And thank you for your viewership. We really appreciate you watching. Thank you.
Thank you.
I love your laugh and your smile. And I love your laugh and smile too, Niall, so you can always do that. You can make sure to go to our website, send us your questions. We'd love to hear from you, just like we heard from Randy. newsnationnow.com/feedback. Or you can download the NewsNation app and you can communicate to us that way. Still ahead. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.